AFMC is really known.
And also make sure
Hello and welcome into this week's edition of AFMC TV. We're glad you're joining us. Today, we welcome Dr. Andre Paixao from the Arkansas Heart Hospital on the program today. Good morning, Dr. Paixao. Thanks for joining us.
Good morning, Michelle. Thanks for having me. It's always a pleasure.
So with February being Heart Month, a lot of times people will see their primary care physicians once a year. And that's at best. There are a lot of people who haven't seen a primary care in a long time, but most people will see a primary care physician at least once a year. And they may think, oh, well, the PCP says everything's fine, so I must not have anything to worry about. But is that necessarily the case? Are primary cares checking out the heart or doing EKGs or anything like that that might spark a further conversation?
A primary care physician will do a general exam. They'll often do labs. They'll check people for diabetes. They check a hemoglobin A1C. They'll check their cholesterol levels. They'll often check kidney function, sometimes liver function labs, and they'll measure people's blood pressure, which is great. And that honestly, that gives most people most of the information they need to come up with a plan to stay healthy. So seeing a primary care physician is by no means a guarantee that you will stay healthy, but the answer may not be necessarily seeing another doctor if you want to further reduce your risks for having things like strokes and heart attacks. Most of our health outcomes are up to us, not to any physician. The patient is the person with the greatest potential to impact their health in a positive way. So most of what you can do to stay healthy is have a healthy diet, exercise, stay away from cigarettes. And there are very few screening tests that have good scientific evidence behind it as far as being able to give you information that will be actionable, give you information that will help you further reduce your risk for things like strokes and heart attacks. So I would say not everybody needs to see a cardiologist for a checkup. For the average person, I would say those measurements that the primary care physician would obtain is enough to come up with a plan to improve your overall health. For some people, especially men over 40, women over 45, and those with additional risk factors for heart disease like high blood pressure, diabetes, high cholesterol, smoking, sedentary lifestyle, or a history of heart disease or strokes in their family. In those people, it may be worth visiting with a cardiologist when they're in sort of their around their 40s or so, or even without seeing a cardiologist, you can obtain a test called a calcium score CT, which different institutions will brand differently. At the Heart Hospital, we call it a Keep the Beat CT or a Keep the Beat screening, where in addition to your cholesterol levels, blood pressure, blood sugar assessments, you also get a low-dose CAT scan that measures how much plaque buildup you have in the arteries of your heart. And the point of that is to gain further information about your risks for strokes and heart attacks over the next 10 to 15 years, and use that information to perhaps more aggressively modify your lifestyle and sometimes start a preventive medication, which is usually a cholesterol-lowering medication.
Because it is that plaque buildup that can ultimately lead to having an event of some sort, whether that's heart attack or stroke, correct?
Correct. The most common immediate cause for heart attacks and strokes is atherosclerosis, so plaque buildup in the arteries of the heart. Cholesterol is a part of it, but it's by no means the only determinant of who will build up plaque. So sometimes we are quite surprised by someone who is seemingly healthy having a lot of plaque buildup without any symptoms. So if we see somebody with no symptoms but a lot of plaque buildup, something that's out of proportional for his age and overall health status, then we can be a lot more aggressive in not only addressing lifestyle changes, but also potentially starting a cholesterol lowering medication, not necessarily to target specific cholesterol values, but in hopes of modifying that plaque, reducing the inflammation in that cholesterol plaque and reducing the chances of those plaques rupturing and causing things like strokes and heart attacks.
Talk about what role genetics plays.
It's a huge role, and in a couple ways. So genetics play a huge role in your LDL levels. So your bad cholesterol levels are primarily determined by your genetic background. It can also impact your risk for diabetes and your risk for high blood pressure. So those are the measurable ways in which genetics can contribute. But there are also, unfortunately, other ways or the pathways that we don't yet know about. So in some families, you have a high incidence of heart disease in the absence of a very high cholesterol, or high incidence of diabetes, or very high blood pressure readings. So those are likely mediated through a combination of genes that lead to heart disease through different pathways that we haven't yet identified. So that's when the family history comes in, and that's why that's part of how we measure future risk. Having said that, even though all the research that's out there of the genetic panels that are out there that are supposed to further improve our ability to predict strokes and heart attacks, the results have been fairly disappointing. There's yet no commercially available genetic panel that can really impact our prediction of future risk for heart disease. Nothing that would be applicable to the entire population. So for the most part, when we are judging someone's risk, we rely on their family history to tell us what their future genetic-based risk is. The beauty of the calcium score CT, though, is that it's looking at the very earliest sign of the disease. So it's going to reflect both your genetic and your environmental risk factors. So the calcium score CT doesn't look at what's driving your risk, but it's a great combination of your global health based on genetics and environmental factors.
So if you took the genetic information and laid that up against one of the keep the beat screenings, does that provide a larger picture or not necessarily?
No, not okay. With genetic assays we have nowadays. One of the benefits of having better genetic scores would be that you can start early. One of the limitations of those CTs is that they measure calcium. And young people can have plaque that does not yet have calcium in it. So it's a great way of screening your heart, of assessing your risk once men are in their early 40s and women in their mid to late 40s. But if you want to look at someone in their 20s, that CAT scan won't really tell you much. You will almost certainly not detect any plaque, primarily because there's yet no plaque, but in some instances because that plaque doesn't have calcium in it yet. So to screen this young population, a genetic panel would be very, very interesting. And I believe there will be some at some point, but to the extent that we have things widely available, none of those assays that are on the market now really add a lot to what we would call traditional risk factors, especially if you add the calcium score to that to that traditional risk factor model.
Okay. And my last question that I want to ask is, because it's somewhat of a familiar term, people will hear that someone has had the widowmaker, they've died of the widowmaker. What does that mean when they hear that phrase?
I hate that word.
Oh.
So people use the widowmaker to describe one of the arteries in the heart. It's the artery that supplies the most heart muscle. And so if you have a plaque rupture in your LAD, in your left anterior descending artery, especially in the very beginning of it, there's a lot of heart muscle at risk. So that was called the widowmaker. But honestly, nowadays people use that to describe any little plaque in the LAD, and it gives people the impression that only those blockages can be fatal. That's absolutely not true. A heart attack in any other distribution of your heart can be fatal. They may not result in a large heart attack, but you can still have bad outcomes from those. And interestingly, when you look at the distribution of plaque in those calcium score CTs, it doesn't really matter where the calcium is. We're just using that calcium to judge your overall burden of atherosclerosis, so your overall amount of plaque. And that overall score is what's driving your risk, not necessarily where you're picking that up. And so the term widowmaker has kind of fallen out of favor, at least in the scientific literature. And I don't love using it to communicate with patients. I think it oversimplifies things and also gives the impression that only men have heart disease, and that's not true. Yeah.
Sure. So at the end of the day, it all comes back to diet and exercise in terms of reducing that risk, lowering that risk, so that potentially that might be an issue you don't have to deal with.
I think so. Prevention is a lot more up to us than our healthcare providers. So a healthy lifestyle, not just involving physical activity and diet, but also staying away from cigarettes, making sure your blood pressure is well controlled. If you have diabetes, trying to keep your hemoglobin A1C as low as possible. So those things are all within our reach, and we can have the strongest impact on our longevity by addressing that early on.
Okay, Dr. Paixao, is there anything else you would like to add? How can people find you?
The Arkansas Heart and Hospital website, you can see my satellite locations. I'm in Little Rock, Hot Springs, our new hospital in Bryant, but also our new clinic in Texarkana, which is where I'm at now. So at Arkansas Heart and Hospital website, you can get to our appointment line, and it should be pretty easy to get an appointment.
Fantastic. Okay, thank you for your time today.
Thank you, Michelle. It's always a pleasure.
Always fun to have you. And thank you so much for joining us today. We'll see you back here next week for more AFMC TV.